So fish oils are very effective. They sell these, at Costco or at food store. They're not regulated by the FDA. And they are primarily used at treating your triglycerides. So they can lower your triglycerides by 30 to 40% if you follow the directions on the bottle. Depending on the dose per pill, it depends on how many you're supposed to take. They don't affect the HDL. They don't have much effect on the LDL. They can actually raise your bad cholesterol a little bit, not much. The biggest side effects are a little bit of GI upset and so-called fish burp, so you burp and it kind of tastes like fish. But for the most part, fish oil is very well tolerated. I've got a lot of patients on fish oil, and it definitely helps your triglycerides. There is now a very new drug out called Lavazza, which is basically concentrated fish oil, the omega-3 fatty acid part of fish oil tablets in higher concentration. It's a little bit better tolerated because it doesn't have all the other stuff in fish oil. It's just the omega-3 fatty acid piece. And it's 4 times stronger and less side effects. But it's a prescription, non-generic medication that's only been out for maybe a year or two. But it's very effective for people who have familial inherited high triglycerides. Their triglycerides are in the thousands.
Do you know anything about krill oil?
So krill oil is also omega-3 fatty acids, so it's a lot like fish oil in lowering your triglycerides, is my understanding.
So
but it's less studied than fish oil.
If your triglycerides are normal,
yeah.
Would you recommend taking fish oil supplements at all?
No. So you really want to target, so one of the key things to start is you kind of want to target your goal. First of all, figure out what your goal therapies are. So everybody triglycerides under 150. And if they're like 180, 200, triglycerides are the least heart attack producing of the 3 components of your cholesterol. So I don't get too crazy about trying to really get them down. But one of the key kind of themes throughout this talk is going to be that you need to find what your target levels are of good cholesterol, bad cholesterol, and triglycerides, and then treat specifically for those target levels. So if the only thing is elevated is triglycerides and nothing else, then a statin is not going to be as effective as fish oil. If the only thing is elevated is your bad cholesterol, then you're better off with a statin and not necessarily needing fish oils. Yeah?
Yeah, on the subject of fish oils, what if you increase your diet in terms of consuming fish in general?
Yeah, that's the best. Yeah, right? There's only so much salmon you can eat. I eat salmon 2 days a week during the summer when it's fresh and available. By the end of summer, I'm just sick of salmon. But yeah, that works. That's why the way they figured this out is with the Inuits up in Alaska. There were a lot of them are overweight, diabetics, and more recently, smokers, and they eat tons of salmon, and they were dying at rates of heart disease less than what would be expected for that population. They have a very high rate of heart disease in the Native American population now because of diabetes and smoking, but in the past they had a very low rate of heart disease because they ate so much fish. And they were eating seal blubber and things like that, and they still weren't dying of heart disease, and it's because the fish oils were protecting it in general. And that's kind of how this whole theory started. And then they wouldn't.
And that's not farm raised, right?
I don't know if there's a difference. I mean, from a omega-3 fatty acid content level between farm raised and native. I know like one of the ways that Copper River salmon got sold was that it had the highest rate of omega-3 fatty acids, and they were like 2% higher than populations of salmon that came out like Bristol Bay. But they marketed it good, So there is some difference based of salmon populations, in particular on their omega-3 fatty acid levels. I don't know what the farm raised versus. But like I said, it's hard to for fish oils to be effective. You got to take it every day. So if you eat salmon every day, you're good. But not many people eat salmon every day. Some people eat it, not many. So that's fish oil. Niacin. So niacin is available in multiple different formulations. Some of them are over the counter, and some of them are not. Some of them are prescription. So they have immediate release niacin, they have Niaspan, and that's a prescription, and we're going to talk about the difference between these. And they have over-the-counter niacin as well, that's a slightly extended release. All of them should be taken at a maximum dose of 2 grams a day, but usually a starting dose of 500 milligrams, and you kind of work your way up. These are really, at this point, the only, they're the best, I should say, not the only, the best drug at increasing, or supplements to increase your good cholesterol. They decrease your bad cholesterol about 5 to 10%. This says 25%, but that's a bit of a stretch. They increase your good cholesterol anyway from 15 to 35%. So they're fairly effective, and they actually decrease your triglycerides as well. So they kind of get all 3 components in one. So niacin is a good idea for most people. So this is just a dose kind of graph. So basically it says the more you take, so 1 gram, 2 gram, 3 gram, the more it's going to lower your cholesterol. But the biggest bang for your buck is at about 1 gram, and then you don't gain a whole lot going up in the dose. You gain something, not a huge amount. Yeah?
Is niacin safe to take if you have diabetes?
It is. I've got I think I got a slide coming up about the safety of niacin. Yep, there it is. So, yeah. To remind me about that. So, so this is just a slide, a little bit confusing, looking at niacin on top of taking a statin, whether it be prescription niacin or over-the-counter niacin. And basically what it shows is that by adding niacin to a statin, it just makes the statin more effective as well. So the biggest problem with niacin that a lot of people get is side effects can be intolerable for many people. And the biggest side effect is flushing. So these are reasons why you can't take niacin, to answer your question. So gout, liver disease, or stomach ulcers. And I actually didn't know this until I made this talk. It'll make your gout worse. So, but the biggest thing is flushing. And so this is the difference between prescription niacin and non-prescription niacin, is really the flushing. They're just as effective at lowering, your bad cholesterol and your triglycerides, and most importantly, they're just as effective at raising your good cholesterol. The only difference is the more expensive prescription niacin, which is called Niaspan, which is long-acting, has less flushing. So these are the number of flushing episodes. So this is the over-the-counter niacin, and this is the prescription niacin. There's much less flushing, but that's the only difference.
What's that?
Huh?
It's flushing.
So flushing is like if you have menopause and you feel all red and feel like you're hot all over.
Hot flashes?
Hot flashes. That's what flushing is hot flashes. So and women seem to tolerate niacin better than men because I think they're used to the hot flashes. Men don't like it.
What about the one they advertise as non-flushing?
That's the long-acting niacin extended release. And that's the difference between the prescription and the non-prescription. So the so-called non-flushing niacin still has flushing, just much less than the over-the-counter stuff. And then one real, so a couple of things about flushing, because this, I would say probably half the patients can't take niacin if they just take it in the morning because of flushing. So a couple of things. Number one, expect a little bit of it and know that it's not harmful. And that kind of helps people, and that it's usually short-lived. It's usually worse in the first few days or weeks that you take niacin, and it gets a little bit better over time. The other thing, this really helps a lot with flushing episode, is to take aspirin at dinner time and take your niacin right before you go to bed. And the aspirin helps prevent the flushing. And taking a bed, if you do have flushing, most people are asleep by the time it hits them, and they don't know. So, so that's one of my top tips from today. If you take niacin.
How much aspirin?
So most people with cardiovascular disease should take 81 milligrams of aspirin. And so I just have them take their regular aspirin, just take it at dinner, and take the niacin before they go to bed. And that usually makes the flushing better, but not for everybody. Some people still can't handle it.
Is there still a product, niacinamide, which is supposed to be a non-flushing type of niacin?
Niacinamide? I don't know if that's another name for Niaspan or not.
We used to be an over-the-counter thing.
Oh yeah, they have immediate release niacin that's over counter, and they have a slightly extended release niacin, which is probably the niacinamide, which is better. And then Niaspan is even longer acting and slower releasing, and that's the best as far as flushing. So there's kind of 3 tiers.
Can you recommend an alcohol to drink with the niacin?
No. So alcohol. So that's one thing on here is high-fat meals and alcohol will make flushing worse, and it doesn't matter what kind of alcohol. Drink your alcohol in the morning, take your Niaspan at night. Right? Yeah.
Are there foods with niacin in it that you would say?
There's foods with niacin in it. There are some foods with niacin in it, but I don't know what they are. And they're in fairly low doses, so the only way to really get concentrated dose of niacin is take it. But there are probably foods with high niacin concentration. Yeah.
What if someone has very good HDL
Yeah.
in the 70s?
Yeah.
But their LDL is, say, a little high.
A little high. You know, if your LDL cholesterol is borderline or just a little high and your HDL is that good, I usually don't put people on anything because your HDL really protects you. Interestingly, there's a group of people in Milano, Italy that have extremely high levels of good cholesterol, and in particular this cholesterol called APOL1A Milano, HDL cholesterol. And almost nobody has heart attacks in this town. And so they genetically found this thing, and then they produced this HLA1 Milano HDL cholesterol, and they actually infused it into people as an IV drug, and it actually melts away cholesterol plaques. And they're working on trying to get this approved. And so it's very interesting. And so it's a really high good cholesterol, and there's a whole story behind it, but beyond that. But that's something that's in the pipeline to basically kind of melt people's plaques away, put me out of business. So anyway, that's my flushing tips. Anybody here on you guys don't have to ask a question, but anybody here on niacin that had flushing on niacin?
Yes. Terrible.
In the past.
Yeah. Did you guys try the aspirin trick? That works in over half the people.
I got incredible itching as
Yeah.
well as the flushing.
Yeah. Did you? And so I find that people that have flushing, if you get the prescription Niaspan and do the aspirin trick with the aspirin at dinner and take the Niaspan at night, most people can get through it. But there's some people that still live here. All right. So on to prescription stuff. So this is a list of stuff that I come up with: the statins, Zenia, Niaspan, which we already talked about, bile acid resins and fibrates, which we won't talk too much about. Most of the talk is about statins. Statins are probably one of the most, if not the most effective drug ever.